here with Michelle, and we 3 weeks ago delivered her neuromuscular orthotic, and she is in for her first adjustment today. We tensed for 40 minutes and just adjusted a little bit. But Michelle, kind of update us on the improvement you've seen over the past 3 weeks since you've received the orthotic.
It's like night and day.
Night and day, huh?
Yeah, I really didn't, I hoped, but didn't expect too much. Because, I've been through a lot already with
Right.
everything, but it is a lot of improvement.
Tell us where you have seen the improvement. What pain has alleviated over the past few weeks?
Well, mostly, a lot of my jaw pain is gone. I mean, it's still there, of course.
Mm-hmm.
You have different pain because you have your teeth are more sensitive, because you're getting used to the orthotic and
Right.
stuff. So you have the different one, but you can tell the headaches are not as frequent.
Okay,
So
good.
that's not as bad. I'm able to start eating now.
Okay.
I can drink.
Whereas you were having to be soft foods really.
Well, I couldn't even eat. I couldn't
Okay.
even chew. So
Okay.
it was awful. It
Yeah.
got to the point where I couldn't even drink through a straw. So
Okay. Very
really
good.
bad.
And so this is improvement just after receiving it. It's been, we typically do a first adjustment after a week. It's been longer. It's been 3 weeks for you, and so you should see even more, more pain and symptoms alleviated as we go on. And but it's exciting to know just you've already seen the headache improvement, the jaw improvement. You're able to eat and chew. Anything else? Is that really the main?
Those are
The main things.
Yeah.
Very good.
I'm actually able to open my mouth, whereas I couldn't before.
Right.
And stuff.
Right.
It was
A big improvement so far, especially after 3 weeks.
Yeah.
Oh, very good. Well, we will continue to go through with your treatment and get updates as we go along. So thank you, Michelle.